What you doing?
Ran out of space on my phone, so I'm deleting some stuff. By singing dog. By goal.
I pronounce you.
By wedding ceremony.
Stop. At Metro PCS, you get 2 free phones with twice as much memory.
Really?
Don't say bye to your memories. Switch to Metro PCS and get 2 free LG K20 Plus phones with 32 gigs when you switch 2 lines. Metro PCS. Wireless. Figured out. Coverage not available in some areas. Sales tax not included in phone price. Excludes numbers on the T-Mobile network. See store for details and terms and conditions.
Blog Talk Radio.
Hey, folks. How you doing? It's Danny Tisdale, and we are here for another Danny Tisdale Show. And, you know, it's called the Danny Tisdale Show, but really it's all about our listeners. It's all about those that we interview and talk to. So it's just the namesake of the show, and I'm glad that you're here with us on this beautiful, beautiful, beautiful Saturday, even though we did post something on the site saying that we may have snow on Monday. I know the weather changes as it does, and we just kind of go with the flow. And as we do before we get started, and speaking to our great host, we want to talk a little bit about what's trending in the world of Harlem World, and that's on harlemworldmag.com. And these are the things that are just trending. There's tons of things going on, but this is what's trending, and this is the Black Girls Movement Conference at Mist Harlem. Also, we posted something this week with the 2 winners from the Harlem YMCA Volunteers Awards, 2 from Harlem. And little did I know that the Harlem YMCA on 135th Street raised the most money in 2015 out of all the YMCAs in the 5 boroughs. Okay, Harlem, hold it down. Also, Sunday, tomorrow, kicks off the Uptown Real Estate Expo that will continue tomorrow, the 10th, and on the 17th, next Sunday. So check it out. Be a part of it. It's all free. That's right. It's all free. So check it out. Should be nice. And we did a podcast with the 2 gentlemen who are chairs on the event this past week. So check it out. Listen to it beforehand if you can. Also, you can hit us up on Twitter at twitter.com/HWMag. And, of course, our duo 2 sites on Facebook at of course, facebook.com/HWMag. And as I always say, and it's always hopefully will be true, you can check out our Harlem history page on Facebook and get all the history of Harlem from as far back as they've been doing lithographs and taking photographs of Harlem. We've got them on the site. Again, thank you for being with us. And today we have a great conversation, I think, in talking about healthcare in Harlem, and healthcare, quite frankly, throughout all the boroughs. And we're talking to Mr. Moises Perez-Martinez, and I hope I didn't destroy his name, and I know he'll tell me if I did. He heads the Workforce, Community, and Government Relations Department with Advocate Community Providers, which is responsible for oversight of programs and initiatives in workforce and training, community and patient engagement, cultural competency, and health literacy. Mr. Perez is a seasoned executive in the design, development, and management of innovative health and human services. He is a founder / co-founder of numerous iconic community-based organizations such as City as Schools, which I love, The Door, which I love even more, El Puente, and Alianza Dominicana. He has received numerous awards, including the Points of Light Foundation Award, the Ellis Island Medal of Honor, the Distinguished Alumnus Award from Brooklyn College, part of the CUNY program, the Center for Community Health Partnerships. This brother's been busy. Mr. Perez graduated cum laude from Brooklyn College and was a member of the prestigious George Edmund Haynes National Urban League Fellows Program. And Mr. Martinez, we thank you for being on the show. Thank you, sir, for being here and your continued great work.
My real pleasure, Danny. It's a first for me, and I hope it's not the last time we have an opportunity to speak on this topic and other topics as well. The only thing that's missing is from my bio was the really privileged and wonderful opportunity I had a few years ago to manage Charlie Rangel's campaign.
Ah.
Which was another, so I know the Harlem community for a very long time and enjoyed pretty much the whole team there.
Know it very well. Know it very well. Well, and I guess this is one of your hats, and with that, what does the Manhattan Healthcare Network do, and what is ACP?
Well, in order to answer that, we really have to start with what is happening in healthcare in terms of Medicaid. We are undergoing now one of the most massive transformations of Medicaid as we know it. I think that most dramatic reform of the entire Medicaid system that we have ever had. And the reason why it's massive is because unlike other reform efforts, includes a really huge sum of money, about $8 billion in incentive payments to really move the system to a new level and to provide the kind of resources to do that. And the reform and what ACP does, ACP is one of 25 networks of providers in the state of New York, 12 in the city of New York. We are the second largest network. The first or the largest network is the Health and Hospital Corporation. And the networks, which are called performing provider systems, have three major tasks to accomplish. One is to make some significant reforms in the delivery of care in terms of how the care is delivered. And that includes utilizing technology and implementing a whole range of other things, integrating, for example, primary care and behavioral health. These are major initiatives in that area. The second set of
sounds like it.
The second set of tasks is to make major improvements in how we manage chronic and major illnesses, acute illnesses. And in our case, because they're so prevalent in our community and certainly in the Harlem community, we're talking about diabetes, asthma, and cardiovascular diseases. And then the third challenge that ACP has to deal with is to launch projects that are essentially preventive in nature that address population health. And the idea is that if you make changes to the system, you manage illnesses that weigh heavily not only on the health system, but bring a lot of pain to our community, and you do something about prevention, we're going to end up with much more livable outcomes. And the whole idea, this, of course, being a reform to the system, is that we figure out ways to reduce the cost of health care. As everybody knows, in the United States, we spend more money on health care, yet we have little to show for it. And this is what we're trying to do here.
Right. So was there one individual that initiated this process, and this is probably not a fair question, or was it something by way of the industry, let's say in New York, where the light went off and we said, something really has to happen, or was it part of what's happening with Obamacare?
That's exactly right. I was going to say the individual is President Obama, because this is an initiative that flows out of Obamacare. The name of the project is called, in its acronym, DSRIP, which means Delivery System Reform Incentive Payment Program, and that's exactly what it's trying to do, to provide an incentive to change the delivery system in a way that is, a lot, more positive. And it is a federal program. And the state of New York, like all other states, so far there are 8 states that have begun to implement this reform, had to apply. And in order to apply, which happened under the Cuomo administration, we went through a 3-year process that people refer to as the MRT, the Medicaid Reform team process, and there were meetings throughout.
I've heard of it. Yeah.
To get people thinking about how do you reform the system, and these are the recommendations that came out of it. And so the state took all of those deliberations, sent them to the federal government to get a waiver that allows us to spend Medicaid dollars in a different kind of a way. And that's how this came about. Now we're into our second year starting April 1st. So we've been doing this for a year and then an additional year of planning that it took to do this. And it's an amazing undertaking. And the Cuomo administration has been masterful, quite frankly, at moving these huge sums of monies and holding people accountable to the changes that they, said that they would bring about in the system. So it's a major sort of reform that's taking place in healthcare in New York State and New York City in particular.
Yeah, no, and it sounds like the due diligence that needs to happen to have success has, taken place. No one kind of sounds like woke up one morning and said, "Oh, let's do this. Here's the money." So the money's in place, Mr. Perez, for everything to kick in gear?
Absolutely. The one thing that I do want to say about ACP, that ACP is completely different than the other 24 networks that have come about. All of the other networks,
how's it different?
All the other networks are led by hospitals.
Oh, I see.
ACP is led by doctors. We're a network predominantly, and we do have hospital partners, 15 hospitals that partner with us throughout the community, both public and private hospitals or voluntary hospitals. But our network includes 2,000 physicians and several hundred community-based providers. And these physicians are in every neighborhood, every zip code, in the 4 boroughs. We don't operate in Staten Island. And that's an important distinction because these are the doctors that have been in the neighborhood, who know the streets, who work with people in kind of a different way. And I believe that our network is going to yield some of the most important, outcomes under this initiative.
So how can families in Harlem or wherever they may be take advantage of the program?
Well, it all starts, and this is one of the most important messages that whenever we get out there, we try to get to people. It all starts with your primary care provider, because under this initiative, the primary care provider has an heightened role. It is the job of that physician who takes care of you to really work with you in a comprehensive way. And we're implementing another initiative under this project that is required of all primary care providers, and that is to become what is called a patient-centered medical home. Mm-hmm. And what the patient-centered medical home, which is a certification process that a medical practice of primary care providers goes through, essentially is it creates a system where the doctors have to deal with the total person. You can't just go in, for a headache, and then goodbye, take 2 of these, and we'll talk to you tomorrow.
Give a subscription, and that's the end of that.
Primary care providers. And it's important that patients are, educated about this, that they have new expectations to place on their doctors, to be taken care of and seen as an entire person. That's why, for example, the integration of mental health and physical health is so important in this case. You can't exclude one from the other because these things all impinge on each other, and they have a bearing on each other and on the final outcome. So all of our medical practices are undergoing this certification process of becoming patient-centered medical homes. That means that they have to be connected electronically so that if you go to the emergency room, for example, for whatever reason, your doctor will get a note from the emergency room saying, hey, so-and-so is in the emergency room, and they can follow up on it. The way that the system works now, you can go into an emergency room and your doctor won't know about it until you go there. Could be a year later. So that these are the kinds of systems systemic changes that are taking place. But the important thing is that the way the people begin to, if you're on Medicaid, begin to sort of access these services to find out who is your primary care provider, and to try to make sure as much as possible that they're a doctor that is culturally relevant, that looks like you, which is the advantage that we bring to the table. Our doctors are from the community, of the community. You know, they work in communities where people feel akin to them, who speak their language, where the staff also understands, you know, the lay of the land and so on and so forth, and to begin to develop that relationship, you know, on the basis of knowledge. And I think that is ultimately what is going to be most impactful in healthcare. Yeah,
and that sounds great. And I'm not just saying that just because you're here and we're talking. It really does sound great, and it's a common sense to me, a common sense approach to doing what quote unquote doctors do, which is that old-fashioned bedside manner. It's almost going back to that. And we're going to go into a quick station ID, but I wanted to instigate a little question for you before we go into the station ID. Does it cost more money to service a patient who doesn't have insurance as opposed to servicing a patient who does have insurance? And I'm going to circle back to you after the station ID and hopefully get an answer out of you. And I just want to let our listeners know they're listening to the Danny Tisdale Show, and we, of course, are talking about healthcare in, Harlem, and quite frankly, all over New York State. And we're talking to Mr. Moises Perez-Martinez, and we're coming right back to him right now. And Mr. Perez, does that question make sense?
Yes.
Need a little more clarity on it? Okay. What do you think about that?
It's a very, very, very important question. In fact, it really drives so much of what is going on in healthcare right now. But here's the situation. If you don't have healthcare, more than likely it means that you don't have a good job. And even sometimes when you have, you know, some degree of health care, it may mean that, you know, it's not a great package for you to work with, which means that putting out money out of your pocket if you don't have a good job is a tremendous problem. And most people can't do it. Right. So what happens is that they end up not going to the doctor on a regular basis, feeling sometimes discomfort and pain, you know, and things like that, and not taking care of it because of the cost until it becomes a major problem. And in the case, for example, say of major illnesses, we know, for example, that if you detect most cancers, not all of them, but most of them early, you can treat them. But individuals who have no money to go to the doctor to take care of things, you know, before they become real problems, end up creating huge, you know, a bigger problem financially for themselves and for the state, because in the United States, in New York State, you can go into an emergency room, and this is the problem, avoiding the use of the emergency room instead of primary care. And that's what I was stressing before, that going, you know, finding out who your primary care provider is, your doctor, and developing a relationship and going to your doctor on a regular basis, at least annually for a physical exam, and taking care of things is ultimately what's going to save, you know, money in healthcare. So it really costs so much more money when people do not have health insurance.
Yeah, and I think that's a great point. And I guess, like most things, you know, with time we learn and then use our common sense. And from what I hear you describing and talking about is really a common sense approach in this medical medicine insurance scenario. Another question is, how do you help someone who is a non-Medicaid recipient? Can they be helped also through this program or not?
Well, the best way to help them, if they qualify, is to get a Medicaid, because this is really a Medicaid program. And as a federal program, it is available to individuals that are, of course, who are documented to be here in the United States in the case of immigrants and so on and so forth. But it is really strictly for Medicaid recipients, although private insurers are also taking a look at what is happening in the Medicaid side and beginning to adopt some of the same measures.
Interesting. Now, when and how can families start signing?
Danny,
I'm sorry. Go ahead.
But for someone who does not have health insurance, there are organizations throughout the city that facilitate the enrollment, assuming that they qualify. For children, for example, while their parents may be undocumented or something like that, if they're immigrants, they can't qualify for health insurance in the state of New York. The state of New York is very generous in that regard, and there are lots of entities throughout the city of New York and the state that will help people file, the paperwork, put it together, and apply. And it's just very important that people do that.
No, and you raised a great point that I may have missed. And how would someone go about finding if they're eligible and who they can talk to if they're an immigrant or anyone else and need help? Is there a phone number, email address, or a URL, or keywords they can search online?
One of the most important organizations, unfortunately I don't have the number right here at hand, is Community Service Society, that has a very broad program to run by David Jones to enroll individuals in health insurance. The other place to call is the Health and Hospital Corporation that, in fact, under this program, will be getting the majority of patients who are uninsured, to be cared for. So any of the public hospitals, Community Service Society, and the New York State Department of Health, if you go online, has a listing of organizations throughout the state that are funded to provide this service.
Well, you know what I'll do is that we'll be posting this conversation almost an hour from now, and we'll add those links at the bottom of the post. And we've worked with health and hospitals in the past, and it shouldn't be rocket science to find a Community Service and Society website or phone number. That's great.
And particularly that in the Harlem world, East Harlem is particularly stressed. There are pockets of hot spots, for example, within the Harlem community. In Central Harlem, some of it gets hidden in the data because, as you know, Danny, you've had a change of young professionals and different kinds of individuals moving into Harlem now. Their good health sort of data, clouds the fact that we have deep pockets of need throughout Central Harlem. People shouldn't be sort of, thrown off the course on that. There are still
No, you're
Central
right.
Harlem, West Harlem, but East Harlem in particular is a hot spot for ACP. We have large numbers of patients altogether in Harlem. We have approximately 70,000 patients that we're caring for through our network of hospitals, doctors, and clinics, and affiliation with some of the hospitals, in the area. And East Harlem, again, in particular, is a real hot spot.
No, I hear you completely, because we were doing some research on our demographic, and we found out that one part of our demographic makes $80,000 plus annually, lives on one side of the street, and on the other side of the street is someone making, under $25,000, and they have a family, and that's just the block. One person on one side of the street, one person on the other side of the street. So I hear you completely.
The ACP, Danny, was created by Dr. Ramon Talaj. He's a physician that's based in Washington Heights and in the Bronx. And one of the things that he did was to really make sure that in the network you had a wide range of immigrant doctors. So in Harlem, for example, you have like Dr. Abedali, the serves a very large African immigrant community in Harlem. And these are the kinds of doctors that ACP, is very much involved with, bringing doctors, again, who can reach populations that sometimes are hidden, like a lot of the African, and in the Bronx as well, we've got a wide range of doctors, who serve African populations and Islamic populations as well. And that's why this network is so powerful in its approach to reforming Medicaid.
Well, and I understand, too, that we have, I'm not sure if it's the right word, newer populations like individuals and families from the Russian community moving into Harlem, from the Chinese community moving into Harlem.
The Chinese community represents half of the network. The president of ACP is Dr. Henry Chen, who's a very renowned physician in the Chinese community, and we have huge pockets. Half of the network is Chinese. In Chinatown, in Sunset Park, in Brooklyn, and in Queens, Flushing, where you have a huge Chinese community. So our network is so ethnically diverse that it's just amazing. You're talking about Pakistanis, African, Caribbean doctors. We have a group of Caribbean doctors, for example, in Brooklyn, organized under a banner called Brooklyn, spelled different, slightly different. They serve, different populations there.
Gotcha.
And again, the Chinese doctors are just amazing as well. So it is the strength of this network that brings together these doctors and providers that can really address the needs and concerns, of a wide range of patients in our communities. And in Harlem in particular, too. Harlem, our patient doctor base is fairly also diverse and cuts through, a wide range of ethnic backgrounds.
Yeah, I just want to say, and we're down to our last 3 minutes, I've been to quite a few different states and traveled outside the United States, and I just want to give you your props. You're really doing some great work, and I really am interested to see how this ends up playing out and affecting the community. So, Mr. Martinez, if there's anyone listening to the show and they want to find out more about the program, just in general, do you have a website that they can go to? Or
yes.
Okay.
Our website is, of course, www.acppps.org.
Great. Can you give it one more time? Okay.
Yes. acppps.org. Call our general number, which is 844-ACP-PPS2.
That is fantastic, and thank you for that. And let's see, we are at our last minute. When you are, if you ever have any downtime and you want to get away, what is your favorite place in Harlem that you like to go to?
It's actually, I would say it's two major streets. First of all, I absolutely love, or three, I would say. I absolutely love, and ever since I was a child, I love 125th Street. It feels, there's nothing that feels more like Harlem to me than 125th. But also Lenox Avenue up and down from 110th, all the way down. There's just so many clubs and places and lounges and restaurants, to take.
So true.
But
true.
One street that really feels like real close home to me is 135th Street. Because I used to come as a kid when I was 12 years old. I would cross over from West Harlem, cross over, the High School of Music and Art and City College to go to the YMCA to go swimming. And then, of course, there's the Schomburg there and Harlem Hospital that I worked with closely over many years. So I would say that those are the places that probably in Harlem have the greatest meaning for me.
And that's I love your passion, and I love the work that you're doing, and I love the places that you hang out, because those are some of the places I hang out and love to people watch. Thank you for being on the show, and I will reach back to you very soon. Thank you, sir, and thank you for the work you're doing.
My pleasure. Thank you for the opportunity.
Bye-bye. Thank you, folks, for listening to the show, and we will talk to you very soon. Bye-bye.
What you doing?
Ran out of space on my phone, so I'm deleting some stuff. By singing dog. By goal.
I pronounce you.
By wedding ceremony.
Stop. At Metro PCS, you get 2 free phones with twice as much memory.
Really? Don't say bye to your memories. Switch to Metro PCS and get 2 free LG K20 Plus phones with 32 gigs when you switch 2 lines. Metro PCS. Wireless. Figured out. Coverage not available in some areas. Sales tax not included in phone price. Excludes numbers on the T-Mobile network. See store for details and terms and conditions.
With free next-day delivery from Staples, you can run your business like a pro. You can guarantee the marketing department that they'll get their supplies tomorrow, and guarantee the accounting department that they'll be delivered free. With free next-day delivery, you'll have the ability to move deadlines up and adjust budgets down. Go to staples.com and get the office essentials you need delivered next day for free. Staples. It's pro time. Orders over $49.99 placed by 5 p.m. Excludes weekends and holidays. Eligible items only.